And a warm welcome to the program. I'm Melinda Akinlami. Our focus is on the Northwest today, but first, our top stories. An explosion has ripped through the Trans-Niger pipeline in Rivers State. The blast, which occurred last night, struck a section of the pipeline in Bodo community of Kano local government area. Thick black smoke billowed into the atmosphere as fire spread quickly into the surrounding mangrove. The Trans-Niger Delta Pipeline, TMP, is a major pipeline that transports crude oil from oil fields in Rivers and Bayelsa states to the Bonny Crude Oil Export Terminal, which is a key point for exporting Nigerian crude to international markets. In Sokoto State, the timely intervention of a combined team of security operatives, firefighters and other aid organizations have averted what would have been an explosion as a tanker carrying petrol fell along Agagi, Sokoto South local government area. Though no official statement has been released at the time of filing this report, the Secretary to the Sokoto State Government, Mr. Muhammad Sifawa, who was present at the scene, coordinated efforts to avert a possible explosion. Movement has been restricted as all roads leading to the scene has been cordoned off to prevent residents from scooping fuel. Security agencies have also sustained efforts to ensure residents comply with all safety protocols. The Jigawa state government has employed about 10,000 security guards to provide 24-hour surveillance in schools and hospitals across the 27 local government areas. The governor, who stated this, said the decision to recruit the guards was made to protect government infrastructure from vandalism.
"9,970 young and agile men and women drawn from local communities undergo training to serve as guards in schools and hospitals across Jigawa State. Following a colorful parade, the guards display karate skills acquired during their training. Governor Umar Namadi is confident that adequate security will be provided with their deployment.
We are witnessing a rampant destruction of these facilities by the so-called benches that normally remove our windows, remove our furniture, and remove almost everything in these institutions. And we felt as a government, a responsible government, we should save this investment. And that is why we decided to bring in this initiative in the first instance. And in the second instance also to give our young men and women a means of livelihood. This initiative is aimed at also ensuring that our communities are also safeguarded. All the young men and women, the 9,974, each one of them was employed from his own community. And he is going to take charge of either the school or the hospital or the court or the water facility in his own community. And therefore we expect the entire community to support these guys, to support them in ensuring that those facilities are safeguarded.
For the Commissioner of Education, schools in the state will now be protected from vandals.
So what government is doing now is to complement that ethics and that intention. Though we have schools sited in communities, courthouses, water facilities, water station facilities, and health facilities, institutions all around. But then the essence is to make sure that we do something specifically targeted of those places because of the rampant theft of equipment of properties and materials in those centers. Because what you call scavengers, Jaribola and the rest of them, who are normally so much engaged in cutting away some of this investment by the government.
With this initiative, the Jigawa State government aims to strengthen security and safeguard public institutions from criminal activities.
For our viewers on the DSTV platform, we're going live to Anambra State as Governor Chukwuma Soludo commissions more projects, for this time in Upoko. Do stay with us. Now, the Adolescent Girls Initiative for Learning and Empowerment Agile project in Zamfara State is set to support about 17,000 girls across 150 schools to equip them with knowledge, essential skills and confidence to navigate life challenges and become productive members of society. The state coordinator of the Agile program, Saidatu Abu Guso, made this known during a one-day capacity building workshop for stakeholders in Guso, the state capital.
The Adolescent Girls Initiative for Learning and Empowerment, known as Agile, is designed to reduce the high number of out-of-school adolescent girls in Zamfara State, where statistics indicate that 62% of children are not in school and 60% of girls face early marriage situations, depriving them of basic education and forcing them to grow faster than their peers. Agile is introducing a life skills workshop for girls in Zamfara State, where the coordinator, Saadatu Abdu Guso, notes that equipping adolescent girls with the necessary skills will help them complete their education and contribute to the development of their communities. The intervention is mapped out to cover 150 schools across the state, with beneficiaries engaging in structured safe space activities targeting over 17,000 adolescent girls.
Through this initiative, 150 intervention schools across the states have been mapped out to benefit from the structured safe space activities, targeting a total of 17,413 adolescent girls through the State Secondary Education Board, the Secondary Education Directorate under the Ministry of Education, the principals, and also the zonal offices.
For others invested in girl-child advocacy, such as the Executive Director of Voluntary Aid Initiative, Musa Umar, the introduction of life skills training will strengthen stakeholder engagement and ensure a successful implementation of the program.
The purpose of this gathering is an inception workshop of life skill component of the Agile program Zamfara State, and is to bring together the stakeholders in order to understand what life skill is all about, what safe space is all about, and how can we strengthen partnership and collaboration towards achieving the life skill desired goal in the Agile program. And just like I said to the participants, we have about 150 secondary schools that will be conducting these safe space activities in the schools. And we are targeting about 17,413 adolescent girls, basically those in the senior secondary schools in Zamfara State.
The Agile project, a World Bank-supported initiative, remains committed to increasing access to quality education for adolescent girls in the North, with the hope of reducing early marriage and school dropout rates.
From education to health issues, in Kaduna State, the newly established Federal Medical Center, Kafanchan, is set to begin full operations by September. And that's according to the Minister of Health and Social Welfare, Professor Mohammed Ali Pate, who announced the timeline following his inspection of the Patrick Ibrahim Yakowa Memorial Hospital, which is being prepared for its transition to a Federal Medical Center. The minister was represented by the Director of Hospital Services, Dr. Jimo Salauddin, says the presence of the tertiary hospital in Kafanchan will cater to the health needs of the people of southern Kaduna.
The Federal Medical Center Kafanchan in Kaduna State is among the new federal tertiary hospitals that were approved recently by President Bola Tinubu as part of efforts to expand access to healthcare services in the country. To ensure its smooth and immediate takeoff, the Kaduna State government has handed over the Patrick Ibrahim Yakowa Memorial Hospital in Kafanchan to the federal government to serve as the new federal medical center. A team from the Federal Ministry of Health and members of the National Assembly embark on a tour of the facility to elevate its infrastructure, personnel, and ongoing upgrades to ensure it meets specified standards. After the tour, the representative of the minister announces the timeline for the commencement of full operations at the hospital.
We have gotten something inside 2025 for this institution. Unfortunately, a medical director for the center has been appointed and is here also with us. So the moment we start the budget implementation, I believe that within 6 months we should be able to kick off.
The first public hearing I conducted as the chairman of the Committee on Health, and then the first institution to be considered was Federal Medical Center, Kafanchan, which was under my supervision. And I'm grateful to, first of all, to the President of Nigeria that he saw the need to approve the Federal Medical Center.
For the pioneer medical director of the center and the representative of the people of Southern Kaduna, the presence of the tertiary hospital in the region is a prayer answered, and this will curb the difficulties of accessing healthcare services, especially in complex cases.
I work with the Federal Ministry of Health, and what I've decided is that it is a partnership. This is not work for one person. It is a job for all of us. So we'll all sit down and look at all of what we have seen, we'll analyze, and then we can now sit and then make a strategic plan on how to make healthcare, specialist tertiary healthcare, available to the good people of Southern Kaduna.
For a long time, we've had to pay exorbitant bills seeking medical attention in Jos, Kaduna, Zaria, Kano, and Abuja. But now that a federal reference hospital has been brought here, all the savings that we make by staying here would certainly be translated into some economic advantage to us.
The Federal Medical Center in Kafanchan is expected to take off in September 2025 to serve the critical healthcare needs of the people from Southern Kaduna and its environs.
As part of efforts to ensure quality health care for people with disabilities, 100 physically challenged women have been enrolled in the Kebbi State Contributory Health Management Scheme. The initiative aims to facilitate easy access to healthcare services for persons with disabilities. The enrollment exercise was organized by the Network of People with Disabilities in collaboration with Kashema.
Women with disabilities gather in their numbers for this enrollment exercise as the government of Kebbi State promotes mental health care. With more than 1,000 persons already enrolled, the initiative aims at enabling beneficiaries to access free healthcare services.
Everything will be free from the beginning to the end, from the card to the consultation to investigations, drugs, even surgeries. There are many surgeries that are covered by these cases. So I think it's going to help them a lot.
For the Medical Women Association of Nigeria, emphasis on medical checkups, particularly on mental health, is key to the overall well-being of all.
Sometimes they have limitations because of the way they find themselves, but we're here to tell them that it's not their fault. This is how they are, and this is how God created them, or maybe some of them acquired it along the way, but that does not limit them from being whatever they want to be or achieving whatever they want to achieve.
On her part, the Kebbi State coordinator of the Network of Women with Disabilities explains that the outreach is aimed at alleviating the struggles faced by persons with disabilities in the state.
The program is in collaboration with Kechema. Kechema is an agency under state government that has been doing so many things for vulnerables. Vulnerables have been supporting, and as we can see right now, they are enrolling over 100 people here free of charge without a dime. So our people across the 21 local governments are here for them to benefit from the enrollment.
Some of the beneficiaries expressed appreciation for the enrollment opportunity, noting that it would significantly improve their access to health care.
I'm happy, so much happy. I'm happy. We thank the governor and the Kichima Foundation.
This initiative, which is a step towards inclusive healthcare, is aimed at ensuring that women with disabilities have access to essential medical services without financial barriers.
Coming up on the program, we look at the execution of federal road projects in Katsina and Sokoto State. Please stay with us. Welcome back. The Minister of State for Works, Mr. Bello Goronyo, has inspected various ongoing and abandoned road projects in the Northwest region, appealing to various state governments to provide adequate security for contractors and controllers on the site. He inspected road projects starting from Kebbi, Sokoto, Zamfara, and Katsina. The federal government has also pledged to ensure the completion of the 750 kilometers Sokoto-Gusau-Funtua-Zaria road.
The Minister of State for Works, Bello Goronyo, and the team from the Federal Ministry of Works arrived Katsina State to inspect ongoing projects along the Northwest Corridor, in line with the directives given by President Bola Tinubu. Mr. Goronyo's first port of call is the Old Government House, where he meets with the Deputy Governor, Farouk Job. He told his host that although 5 basic road projects will be executed by the federal government in the state, compensation and security concerns remain the major challenges affecting timely completion of the projects.
And then even the highest scale of insecurity we are experiencing today is because of poor condition of roads. Some of these roads are more than 40 years built, and they will not see rehabilitation. So Mr. President is very passionate about this one, and he has given us enough funding to ensure that we put these roads in a proper condition.
Meanwhile, Mr. Job commends President Bola Tinubu for his commitment towards improving infrastructure across the country, pledging to keep contractors handling various projects in the state on their toes.
We are passionate about that project being one of the most important projects that will not only transform our economic activities in the state, but also improve livelihood and security across this zone. I tell you that we do the most needful to ensure that we provide security to contractors wherever they want to operate across the state.
Elsewhere in the Northwest, Mr. Goronyo pledged to ensure the completion of the 750-kilometer Sokoto-Gusau-Funtua-Zaria road. He gave the assurance during an inspection of the ongoing road project along Dang Shuni Tureta in Talata Mafara local government area of Sokoto State, which leads to Gusau in Zamfara State.
The importance of this inspection is to ensure that the contractor is doing a quality job, and then to also look at the possibility of asphalting the road that is badly damaged, so as to reduce the number of road accidents and then to ease the transportation network, particularly to save lives and then to reduce the hours of travel that some of the commuters are facing.
The inspection tour is in compliance with President Bola Tinubu's marching orders to the ministry to ensure quality and seamless execution of all ongoing road projects.
Let's go to Kano State now, where the government has launched a massive Ramadan feeding program targeting 3 million people. Governor Abba Yusuf announced this during an inspection of designated centers responsible for preparing the meals. Our correspondent Sadiq Ilyas was there and has this report.
In a bid to support the less privileged during Ramadan, Governor Abba Yusuf visited meal preparation centers to ensure proper implementation of the state's feeding program.
My intention is that I should take this to my personal, and I will do so. And this is why I'm taking it to my second market, so that we will test it, we will know the
97 centers have been set up across Kano State to distribute meals to the needy. With each center catering to at least 1,000 people daily, the program is expected to benefit 97,000 individuals per day throughout the holy month.
Kano belongs to all of us. Other business moguls at the top, at the middle, and even at the bottom should please come to us. Let's join hands again. Let's see how we can assist the vulnerable members of the society. Our doors are always open. We're not asking for a kobo from anybody. We're not telling you to bring the money so that we prepare the food or we provide the necessary palliatives. What we are saying is that, come, let's have enabling environment like Angote is doing. He's distributing loaves of bread, distributing prepared food, distributing, palliatives like rice and so on and so forth. All others should emulate him, should emulate us, and join hands with it. With that, I believe will ease the sufferings of the majority of the vulnerable people of the state, especially at this holy month of Ramadan.
Ensuring the hygiene and quality of meals is top priority here to safeguard the health of beneficiaries.
As I said earlier on, we are feeding 31,000 people every day from different centers. And based on this work, we employed over 250 staff, mainly for this purpose. And alhamdulillah, we don't have much challenges because already we are expert in this field, alhamdulillah. So it's just to know the first few days. So after the first few days, alhamdulillah, we are used to it now. Everything is going smooth.
There is rice and beef, water. So like you see, this is for 1,000, and each center used to eat for 1,000 people. And I have 30 centers, which is also I have 16 centers. I have 7. And Nasarawa, I have 7 also. Total 30 centers.
This initiative reflects the government's commitment to fighting hunger and providing relief to the less privileged during Ramadan.
That's the program today. Thank you so much for watching. I'm Melinda Akinwami.